Hello, please subscribe and like for our channel. Thanks very much.
Now, in this question, they say that we have a 4-year-old child that presents fever of 2 days duration. Is it clear? Which skin lesions are demonstrated? When you see these skin lesions, generally there are different skin lesions that you have to know. Is it clear? I'll just describe first the skin lesion that you have to know before describing the skin lesion. Is it clear? Now, skin lesions are divided into primary skin lesions and secondary skin lesions. Is it clear? Secondary skin lesions are made up of primary skin lesions. Is it clear? But they have their particular name, their combination of primary skin lesions. Is it clear? Now, so I'm not going to speak about secondary skin lesions because the peculiarity are going to be known when you're knowing the different diseases. Is it clear? Involved with this the secondary skin lesions. So I'm just going to speak about the primary skin lesions, what you can describe on every patient that's just in front of you. So for the primary skin lesions, you need to know that there are different ones. The first one is a macule. Is it clear? And I'm going to directly speak its opposite. Is it clear? So if it's not a macule, it's a plaque. Is it clear? Now, how if it's not a macule, so it's a patch. Is it clear? So a macule is a flat lesion. It's a flat skin lesion that is less than 1 centimeter. While a patch is still a flat skin lesion, but instead greater than 1 centimeter. I hope you understand. The second one is a papule. A papule is a raised, when you have pimples, those pimples that you call, don't say medicine, the medical term, pimples. No, you don't have pimples in medicine. It's papule. So a raised lesion that is less than 1 centimeter is called a papule. Are you understanding? Now, if you have a raised lesion with a flat top, a raised lesion with a flat top that is greater than 1 centimeter is called a plaque. You understanding? A raised lesion that is with a flat top that is greater than 1 centimeter is called a plaque. But a raised lesion greater than 1 centimeter with a dome top or a circular top is a nodule. I hope you know that you are hearing all the characteristic. Now, the next one is in case where you have bruises mean that bleeding underneath the skin. When you have bruises of less than, when you have bruises of less than 4 millimeters, is it clear? Bruises of less than 4 millimeters, they are called petechiae. Is it clear? Bruises of less than 4 millimeters, they are called petechiae. But now, when bruises are between 4 to 1 centimeter, they are called purpura. Is it clear? When bruises are between 4 millimeters and 1 centimeter or 10 millimeter, 10 millimeter is the same as 1 centimeter, they are called purpura. Is it clear? Now, if the bruises are more than 1 centimeter, they are now called ecchymosis. Is it clear? Or yeah, I hope I'm not mistaken. So I'm just going to take a look again in the commentaries. I'm going to explain more. Now, the next thing after that, after those skin lesions, we have depressions. Is it clear? Now, when a depression is less than 1 centimeter, it's called an erosion. And when a depression is greater than 1 centimeter, it's called an ulcer. I hope you're understanding. So if you see a depression on the skin that is less than 1 centimeter, call it an erosion. But if it is more than 1 centimeter, call it an ulcer. Now, the next thing is if you have a raised lesion which is containing fluid less than 1 centimeter, is called containing pus, and it's less than 1 centimeter, is called a pustule. Is it clear? And if it is containing a raised lesion containing pus that is greater than 1 centimeter, is called an abscess. Is it clear? So what you can have on your face, that pus, some small pus is coming out on it like that, is called a pustule. Are you understanding? So those are the different things you have to know. So now, if you have a lesion, if you have a fluid containing raised lesion of less than 1 centimeter, it's called a vesicle. A raised lesion containing fluid of less than 1 centimeter is called a vesicle, while a raised lesion containing fluid of greater than 1 centimeter is called a bulle. Is it clear? So I hope I've said all the different characteristics. So in this case, you can just see raised lesions like papule. We have raised lesion containing fluids like vesicles. Is it clear? And we have also flat lesions. So we don't have flat lesions here. We can have some pustules. Is it clear? Raised lesion containing pus. Is it clear? So in all, which skin lesion do you see? You see papules, you see vesicles, and you see pustules. Is it clear? So you see papulo, vesicle, pustular rashes. Is it clear? Those are the skin lesions that you visualize here. Now, what is your diagnosis? Generally, when papules and vesicles are being seen on a skin lesion, particularly on the abdomen and the thorax, that's central. Is it clear? They are much more in favor of a diagnosis of what? Of a varicella or chickenpox. Is it clear? So every time that you see papules and vesicles which are coalescing together, is it clear? They are mostly coming out and they are central. Is it clear? That's the thorax and abdomen. They are mostly in the diagnosis of a chickenpox or a varicella. Is it clear? And now, the peculiar characteristic of chickenpox is an umbilicated raised lesion. As you can see, you have umbilicated raised lesion, meaning that what? The lesion is raised, and then at the center it is having a depression. It is peculiar for chickenpox. It means that it is called an umbilicated raised lesion. Is it clear? Every time you see an umbilicated raised lesion, think of chickenpox. Now, every time you also now see pustules, you can see pustules at the level of the right hand. Is it clear? Right upper hand, you can see a single pustule there, and even at the level of the right lower arm, you see pustules there. Is it clear? Every time you see pustules, it means that there's a super infection. Is it clear? Now, what is the effective preventive measure? Every time that you don't want your child to have chickenpox, you give him varicella vaccine. Is it clear? So it's varicella vaccine that is the most effective preventive measure. Is it clear? Other measures like preventing contact, that's not the most effective. Is it clear? The most effective preventive measure is to give what? Varicella vaccine. The next one is leads to condition that worsen the prognosis of this condition. Now, any condition that is going to cause immunosuppression in the child is going to worsen the condition of varicella. Is it clear? And what are the conditions that are going to worsen the condition of varicella? Is it clear? The first thing, you have HIV. Is it clear? If you have HIV in this child, it's going to worsen the condition of varicella. The second thing, if you have measles is a state of immunodepression in a child. The third thing of immunodepression in a child is malnutrition. If you have malnutrition, it's going to worsen the condition. Is it clear? Another thing, which is not a condition, but instead a drug that can worsen varicella, is going to be called what? Is going to be called aspirin. Generally, we don't give aspirin to patients. Generally, patients don't have to take aspirin, because if that infection is a viral infection, it is going, and particularly varicella, is going to result to what is called the Reye syndrome. And Reye syndrome is a state of infiltration of the liver resulting to hypoglycemia. Infiltration of liver resulting to liver failure and hypoglycemia associated with a hepatic encephalopathy. That's the triad of patients that they are going to have. Is it clear? You're going to have hypoglycemia, liver failure, hepatic encephalopathy in patients who have taken aspirin, resulting to infiltration of the liver. Is it clear? Particularly in children that have viral infection. Is it clear? So that's the Reye syndrome. Now let's go to the next question.